guests. We ask them relevant questions and we bring different perspectives to the matter. We invite you to join us with your thoughts, your comments, your contributions via the WhatsApp number. And you can join us also on socials. We're on Facebook. We're streaming live on YouTube. We're very interactive on X. We're engaging on Instagram. And you can catch some amazing video content from ChannelOne TV on TikTok. We're going to go straight into it. I'm going to say good morning to the gentleman in studio, and then we'll begin the conversations. Elvis Darko is here. He's the editor of the Newscenta newspaper, newscenta.com. Seated next to him is Wanda Madilo. He's a member of the NDC's communications team. And then we have Ibrahim Adjei. He's a former assistant secretary at the office of the former president, His Excellency Nana Addo Dankwa Akufo-Addo. Gentlemen, good morning and welcome.
Good morning, Nana.
It's good to have you.
Good.
How was your weekend?
Weekend was good. It was quiet.
Was it?
Yeah, but it was good. Yeah,
Wow.
eventful, productive, and so we thank Allah. It's good.
Alhamdulillah. Wanda,
Yeah, I'm very.
how was your weekend?
Very engageful.
Yeah, you just.
I'm very engaged. I was very tired.
You're in Ketu.
I had to cook. I cooked
Eh.
over the weekend. Yes, you should taste it.
I'll try
You
it
should have
someday.
a feel of it.
I'll
I
try
did
it
some-
someday.
Did some good dishes.
You should have come to the agri fair to shop some fresh farm produce.
As a matter of fact, it escaped me.
Honda.
It was when I was going to bed. I listened to the news and I said, "Oh, today's the day," and it was too late. Really, I would have done that. Last year I was there.
You missed out.
Yeah,
you
last
missed
year I was
out.
here,
You
but
missed
this
out
year I
seriously.
missed- I
You
missed
missed
out.
out seriously. How was school? Did we travel?
Yeah, my weekend was very, very stressful, and I had to travel to the village because my aunt had a medical emergency,
Oh, okay.
and I had to go and look at the situation and see what we can do. Finally, we were able to transfer her to Kolebu. As at yesterday evening, God willing, there's some improvement.
Very well.
But the sad aspect is that the whole district hospital for Sabdine, which is at Peki, lacks a lot of things. Labs they are supposed to do, they don't have what they take to do it. They don't have machines to do CT scan and other things. And therefore, the things they are supposed to do to support my auntie's health recovery, it means that they have to, if she's supposed to stay at the hospital there, they have to put her in an ambulance and drive all the way to go and do a CT scan and bring her back. And if 2 days time another doctor recommend another test, which they don't have, they still have to drive her back to Ho, back and forth. So having listened to the explanation, I said, no, then it's better I take her to a place where these facilities are nearby that can easily.
Yeah.
I said, we need to fix our health system. And if a whole district hospital lacks all these things, and as a country we think it's okay, what we are doing is that we are just pretending to be offering healthcare, but we are actually using the system to kill people. And I think that's something that we have to look at.
Very well.
The Agenda 1 hospital being built at Pebe, which is the district capital, is almost, the fiscal structure is almost done. But since this government came to, there's nothing said about Agenda 1, what is going to be done. I believe that if we all agree that 88 hospitals, districts, do not have a hospital in Ghana, it is a serious issue.
I'm
It's
sure the
not
government has its
something
own plans to address
It's not something that we
this
should
matter.
be doing
Right.
NDC MPP with.
Let's go into our business for today. Let's go into our business for today. We're starting off with the Zipline medical drone delivery services. The majority leader is not too excited about this deal. He says he's not for it, and he's actually pushing that the contract be terminated. The former health minister, Dr. Bernard Okoboy, I've heard him speak on this matter, and he says that this is an essential service which should not be cancelled. Ibrahim, I'll start with you. The majority leader in his explanation thinks that we can resource the Ghana Health Service to be able to perform this particular function that we're paying over 170 million to Zipline to do. Quick thoughts.
Good morning once again, Nana.
Good morning.
Respectfully, the Honourable Member of Parliament, Majority Leader, am I right?
Yeah.
Mahama Yaraga,
Yes.
is ill-informed.
How so?
He seems to think, because because I read what he said out. He said, oh, drones cost between 5,000 and 6,000 or 10,000. It is not the drones, and the drones that are being used cost between 10,000 and 60,000. It's the same drones that are being used in Cote d'Ivoire, in Togo, Nigeria, Rwanda. Rwanda kick-started it off on the continent. It's a service that is being used. That 170 million cities that he's quoting covers 6 distribution centers. It's done over 500,000 flights since its inception by His Excellency Alhaji Dr. Mahamudu Bawumia. 12.2 million vaccines have been distributed in that time. In Ashanti region alone, 162 deaths per year, maternal deaths, have been recorded. The cost of actually delivering these vaccines, blood samples, or blood to Ghanaians in remote areas, that's the key thing. Without the drones, it'll cost you, if you're using the motorbike, $15 to $20 per trip. Because remember, you have the vaccine center at the district level, then going to the remote areas. Now, these are figures independently done to assess how much would it cost you if you put it on Okada to then take it from the region to Kratchi, to Gushegu, and so on and so forth. So that's why I say, respectfully, the Honorable Majority Leader is ill-informed. He's thinking that the 170 million is the cost of the drones. You're paid on a delivery purpose basis. What we are charged here in Ghana is, again, likewise with Rwanda, everybody has negotiated differently. But Ghana, I think, under His Excellency Dr. Alhaji Mahamudu Bawumia, has made sure that lives have been saved at a cost-effective and way in which Ghanaian lives has been, as I mentioned, 12.2 million vaccines have been delivered. For some of the vaccines, for those who want to know, it's oxytocin for maternal, for mothers. What does oxytocin do? If, for example, you're post your delivery, i.e. your post-term, 9 months, still no baby, this particular drug can help induce labor.
Okay.
Then you have the venoms within the, as in snake venom.
Snake venom.
Then you have critical blood. Again, you have immunization for children. That has been delivered efficiently, within minutes, not hours. Again, what the service has done, a service that costs us 170 million per year, which the NDC budgeted for. This is like a surprise. Check the budget. They budgeted for, and you have not failed to actually deliver on that, saying now it's too expensive. How much is Ghanaian lives worth that is too expensive?
But the argument he makes is that if we resource the Ghana Health Service, that same amount of money would not be going to a private person. That's Zipline. But now we'll be with the Ghana Health Service. The Ghana Health Service can run the same service effectively. I have
no problem at all in that. In fact, I would encourage that line of argument. We want to be independent as a nation. So yes, who wouldn't want to develop their own resources? We talk about import substitution. Same with service substitution. I'm 100% if that's the line of argument. But you need to prepare something before you do away with something. Because that's what leadership does. Good leadership has contingency plans. Why is it you think that His Excellency Alhaji Dr. Mahamudu Bawumia brought this innovation in 2019? We could have said, oh look, this money, let's build a hospital. Let's build vaccine centers in every single village. It is cost prohibitive. The amount of money to build clinics that are up to date, making sure they are well stocked with vaccines in every, I'm talking the remote areas, is cost prohibitive. What this service does, and then when you calculate the cost of the delivery, it's around 20 US cents. 20, not $1, not 50 cents, 20 US cents per delivery. These are the figures that are coming. Now, this is what Honorable Mahama Ayariga needs to look at. Because that 170 million comes with what? the servicing of the drones, the maintenance and paying of labor for the staff. You say you want to do 24-hour economy. Meanwhile, you're cancelling contracts. That will do what? Cancel lives, increase unemployment, and removing the employment component from my submission here is about Ghanaian lives. If we have delivered 12.2 million vaccines pre-2019, when the MPP introduced the Zipline service, how many vaccines were deployed in the remote areas? We sit in Accra and Kumasi and Cape Coast and Takrady, where we can enjoy regional hospitals, where vaccines can be easily reached because the road network is there. And we forget about the rural people. And we profess, when I say we, NDC profess to caring about the rural folk. Meanwhile, MPP are actually doing something about it to make sure that we can reach them in efficient time. That is the core thing to be focused upon. I'm talking as a government. How much is a Ghanaian life worth that you want to say that 170 million is too much? And the services, I say, it's the drones, the maintenance, salaries, distribution centers that are being manned across the 24-hour period. There was a time when they called something you have stock out. Stock out is this. There's a rural clinic where vaccines are out. They're finished. And it takes them about 7 days for vaccines to reach them pre-Zipline.
Okay.
Because it's not, when you say I'm out, what happens? Somebody has to get the vaccine, find you the lugu-lugus, and deliver it. Oftentimes it can be 7 to 10 days before the vaccines are replenished. Now that stock out has been reduced by 60%. So what will take 7 to 10 days now, within 2 days, your stock has been replenished via Zipline. This is something that I think the Honourable Member of Parliament for Boku should reassess his priorities. And I'll land on this point. We have a Minister for Communication.
Okay. There are reports at Ghana Health Service that shows the cost to Ghana in terms of ability to deliver certain things. Number one, medicines at every health facility are supposed to be kept in fridges, at a certain temperature. Ghana Health Service own report will tell you that most of these health facilities across the country, the fridges don't even function, and the medicine go bad, and we throw it away after paying for it. That is huge. Most of the time, when they have problems with electricity and there's no power, most of the facilities don't have any genset, so the medicines go bad. There are reports in Ghana that show how much the state pays to buy medicines that go waste because of the non-functioning of fridges or the lack of fridges and lack of generators across the country. The Ghana Health Service have those reports. They know. There are reports to show that even when they are supposed to do what Wanda is talking about stock taking and everything, sometimes the hospitals run out of medication and people die needlessly, because of the time it's needed. For instance, if I tell you about where my mother's home, Tatongo, it's at the other side of the river, and beyond the river there are communities. When there's a snake bite, they have to put the person in a boat. The nearest health center is in my mother's village. If they get there, there's no snake, there's no venom, there's no anti-snake venom. We are putting the person in a car to the next hospital or clinic to find out where there is. If there's no, you keep the person is dead. So a lot of work was done, and they realized that can technology bridge these gaps? Can technology bridge this gap? Somebody delivers, and the blood group they are looking for, or there's somebody has an accident and needs blood. The blood group, the hospital doesn't have it at the time. They are looking for people to come and donate. The person is dying. By the time you see the person is dead because they could not get the blood on time. We're losing a lot of lives to these things because we can't get the blood for the person on time. So the idea is there any way we can solve some of these problems and save more lives? So they came up that Rwanda is doing something with a private US company called Zipline. So Ghana went there to look at what Rwanda is doing. and Ghana believes that with the challenges that I've outlined and so many others, if this facility comes in, it could bridge a lot of those gaps. So somebody is at the point of death, maybe an accident or gives birth, and they can't find the blood there. Once they call Zipline Center and there's a blood, within 30 minutes, the blood is delivered to save the person's life.
Right.
So it must still sign my constituency, but where the blood, the place in my constituency, Sujaman is called Enum. So from hospitals to Piki, I talk to WHO and all other places. If there's emergency for blood or some essential medicine that they do not have, all they need is to call Zipline and say, we need this, we don't have. They check so that it's available. Within 30 minutes, it's dropped at the hospital and somebody's life is saved. So when we are talking about physical infrastructure and human beings sitting there managing and looking at deploying technology that can bridge certain gaps and close challenges and save lives, they are not the same. They are not the same. If the fridge is spoiled in the person's clinic and the snake venom is gone bad, and somebody has been reported for snake bite and the person is at the point of death, what will happen to the person? The person will die because there's no snake venom, or the venom has expired because there is the fridge is faulty. There's no generator, there's light off, so the system did not work, and the medicine is gone. Ghana paid for it, and the medicine is gone bad. And the person will also die at the same time. So deploying technology to resolve some of these challenges is not a waste of money. And the majority leaders' argument did not say that we check from Rwanda, they are paying this. We check from Nigeria, they are paying this. And therefore we think that how much Ghana is paying is more expensive. And therefore we think that we need to renegotiate or do something. He's not making that argument. Because as I said, we went to learn from Rwanda to see what they are doing. And then we say, oh, what is the results in Rwanda is beautiful. So we want to bring it to Ghana. So if the majority was saying that, oh, we've checked from Rwanda, this is how much they are paying for a delivery. But I think Ghana is paying this and it's too expensive. So we want to talk about it. It's a different game. Nigeria has deployed it and even expanding it big. If we check from Nigeria is paying less for the same delivery. And therefore, we think that we can renegotiate. It's another issue. But somebody just to wake up and said, 170 million is too expensive without any comparison from other jurisdictions that are also implementing the same thing. I don't know the basis for saying it is too expensive. The idea of we are paying 170 million, the question is it value for money in terms of what is being delivered? When COVID happened and we were supposed to deliver things to certain communities that by road is difficult, it was Zipline that the state deployed to send all those things to those communities where it's so difficult to get to by road. So when we are talking about this, let's not sit in Accra and be talking as if Ghana is Accra. In the remote areas where people are dying because of snake bite, because blood cannot be found when somebody needed blood at a particular moment, when certain essential medications are needed but the health facility doesn't have it, but within a call and within 30 minutes, it is delivered. It's not there's something you'll be comparing to somebody driving a motorbike. How does motorbike get the medicine there in 30 minutes? When the person needs the thing within 30 minutes. So the one we are talking about is let's have empirical evidence to back it. The work has been done. Millions of medications have been delivered. But then the arguments you hear, they don't talk about them. So they don't even tell you how many total number of bloods that have been delivered. Every single blood that has been means that somebody's life has been saved. But also, they say the thing was used to carry condom. The person is providing service. He's not the one who says, I want to carry condom. If Ghana Health Service comes to me and says, oh, we think that delivering condom to this community is becoming difficult to deliver, they will deliver. They are a service provider. If you say go and deliver mosquito net because we are supposed to distribute mosquito net to these communities to prevent malaria, but getting the human beings there has become difficult, so use your drone to deliver it. They are service provider, they will deliver.
How about resourcing the Ghana Health Service to render same service?
This is the challenge you have in Ghana. Do you think that you just go and buy a drone and it goes to work? It is a technology that is backing it. Does the Ghana have that technology?
Can it acquire the technology?
If it can acquire it, sign so that's what I'm saying. So if you say drones, this drone you are saying, it's not a normal drone that you see around. Though.
Can it be acquired by Ghana Health Service?
It can be acquired, but the question is who has the technology to sell to you? Have you identified someone who has the technology to sell to you? They have built their technology. They say They want to offer service and get paid for it. They are not selling their technology.
When the light wave thing came, Makando has announced the games. And the games, we understand 20 hospitals are already enrolled.
Please, the games came from where? The games came from where?
Can we find someone
who
to
owns
also
the games?
develop
Have you
same
asked
app?
who owns the games? Have you know who owns the games? Have you know who developed it? Has anybody asked the cost to the state? Is it this situation when one government to come to power want to terminate whatever comes to the past because we believe that some government officials may be enjoying from it? We also have to give to our own people so that are able to enjoy. Is the reason the country will not move forward?
You think that's what's happening?
That is what we have been doing all these years. Let's focus on the people. You want to terminate a service that is saving people's life in rural community because you are in V8, you are sitting in Accra in a big car. You think that it is needless. But the person who will die from snake bite in a remote area, but with Zipline will be saved. A person may die from childbirth or from motor accident or vehicle accident because it's bleeding and needed blood. And the hospital at that time has no blood. But with a call to Zipline can be saved. You think that those for their lives are not important. And that you have to use a system where whether they die or not is none of your business.
Right.
Well, I've told you that there are several reports in Ghana. So when you look at it, you cringe about what happens at our health systems across the country. So if the world is moving to technology and we can deploy technology to very difficult areas that it will save, let's not just be talking about money. And as I said, if somebody comes out with a figure and say Rwanda is paying this, Nigeria is paying this, we are paying this, and therefore we are paying too much, we will look at the figures and go back. Just to make that statement without any evidence to back it, it's problematic. Because we cannot just wake up and make statements when we have no comparative data to compare.
Thank you.
So please, let's not. Let me add this. The Zipline that we are talking about, the U.S. government is now giving it $150 million. Okay, because with all the data they've seen from various countries, and they see the impact that it is making in healthcare, they believe that the company expanding its operations in Africa, especially in rural areas where it is difficult to reach. Instead of pumping their money into the various healthcare projects they give to African countries, where they give the money to Zipline, they believe that with the result they are seeing, it can do more.
So they took away the USAID and they are investing in Zipline. So
let's not just wake up because somebody wants to give a contract to his friend or somebody and say, terminate this and give to this. Terminate this and give to this. Let's be careful.
2 more minutes on this.
It's important that we understand that these are Ghanaian lives we're talking about, Nana. Zipline. I heard my colleagues, one mentioning that, Agenda 111 there is there, which is 111 facilities. So why not make sure that all those 111 facilities, district hospitals, are properly stocked? And I'm happy that Elvis mentioned that we have a lack of adequate cold chain infrastructure. Vaccine, just like your milk, it goes off. Has an expiry date. And if it's not properly cooled constantly on the value chain, it will expire and be useless. In the rural areas, you talk about Agenda 111. Zipline is serving 65% of Ghana, and listen very well, Nana, 2,500 facilities. It's not Agenda 111. Can you say, okay, let's finish Agenda 111, Obia, it should be okay? How insensitive is that to Ghanaians, especially the rural folk who don't have DSTV, but you're busy negotiating with DSTV. But when it comes to Ghanaians in the rural areas where their lives matter most because they have it hard, Nana. We've done campaigning from 2008 when I campaigned with Dr. Mahamudu Bawumia and President Akufo-Addo. I got to see the whole of Ghana. You go into some areas and you wonder, is this Ghana? Some really rural areas who are like, it's like a world apart. But we sit in Accra and we think we are okay. That is why we are into politics, to add value to the lives of the people who need it most. 2,500 in Lugu. I mean, some areas motorbike can't pass. If you have not traveled Ghana, you want the comment by wonder that you can just deploy Okada motorbikes. We've bought a lot of motorbikes. You don't know Ghana. You don't.
You think so?
I know Ghana. No, no wonder. You have your turn. I'm landing here. Because that comment tells me that you are inexperienced about the terrain of Ghana. You have to go through some waterways, some riverways, in order to get to some remote village. As I'm repeating for emphasis, there are 2,500 health facilities, not 111, that Ghana is saving lives since 2019.
I don't know if there's, I'm happy Elvis brought it up. If there's any kind of, I doubt it. I doubt that they're trying to score political points. Dr. Mahamudu Bawumia brought this as save Ghanaian lives, and so somehow let's remove it because of money. You're trying to say that you can do it better. Why did I give the example that we can do our own power, but we have independent power producers, which they did under NDC, take or pay, which cost us $7 million, dollars every single week. Every single week we are paying because of take or pay. Likewise, buy water. Who they do the cleaning of our water.
Right.
Why are we paying buy water to provide purification services? Go to Teshi, where I'm from, Lejokuku. We have a desalination plant.
It's been shut down.
Yes, but I'm saying, why is it that we don't do our own? When it's cost prohibitive, what you do, you let the private sector take care of it, and then we then pay the service.
Right.
Why are we using these Uber and what have you? Why don't you get in your Okada, your trotro, as one day saying, go all the way to the market, buy your fufu, your wache, your banku, kenkwanwonu, and bring it home. The cost does not make it effective. What will happen is this. You have people, Ghanaians, dying, in those 2,500 facilities. And you're trying to say, I want to save small money, I'm in Accra, you can die, wait for me to deploy to 111 institutions. Find your way there. You're in some lugu in Krachi or Gushigu, and you want me to get in my canoe.
Right.
Elvis made the point. What happened? He said you have to do what? You have to get on a boat. Who in Accra or Kumasi gets in a boat to go to hospital? Come again. Let's put Ghana first. And cancelling this is putting Ghana behind. Right now, 3 centers have been closed. Volta has been closed, the distribution center, Western North and Eastern regions. They are shut down. So Ghanaians don't have service.
To be paid. Yeah. Very well.
What is he talking about?
Would it have helped the conversation better if there was a proper analysis of how much it costs elsewhere and how much we're paying here?
We're not interested in what it costs elsewhere.
We are only interested in terminating the contract.
In what it costs Ghana. I mean, even if it costs Nigeria 2 cedis, we don't care. That's not the issue. The issue is that what is the cost-benefit analysis to our budget? That's Ghana.
And you don't think there's value for money in there?
No, I'm going to go into the issues. We're not worried about what it costs elsewhere. I mean, that argument is flawed. That because it costs something in South Africa or in the US, so it means that what? Then I hear them say, oh, the US government is giving the Zipline 150 million. The 150 million that is supposed to give it to use Zipline is not for Ghana. It is for their expansion in Africa, in rural communities. And therefore, that cannot be the case that, oh, because they are doing well in Ghana, that's why they are giving. And it's actually a pay-for contract that is to be signed. Now, let's go further. I am saying that there are 10,942 health centers in this country. Okay? 10,000. It costs only about 180,000 Ghana cedis to buy a 150 kVA generator. Okay? That's one. It costs only a maximum of about 10,000, 12,000, 15,000, or even 20,000 to get a standard refrigerator for the hospital. Okay? The two combined is 200,000. Divide that by what we are paying a year. We're paying 170 million. You will be able to produce for yourself over, let me just give the exact figures, over 850 of such, 50 kVA generator, and a standard refrigerator. For the hospital. Okay, you can procure 850 out of the 170 million that we spent in a year for Zipline alone. And so if you spread that over the 8-year period, you are getting into about 6,000 and over generators for all the hospitals. He's talking about 2,000 hospitals, and the computation of what we have paid Zipline minus the initial cost of implementation, which is the $12.5 million, you will still would have been able to help over 6,000 hospitals.
You would have to see all these generators.
No, listen, the hospitals are not running free. The people pay. I mean, you go to the hospital, don't you pay? You pay for your services. So it's not as though if you were a private person and you set up a hospital and have a generator, how do you fund it? Wouldn't you fund it? You will fund it. So it's not as though even the ones in Accra don't run on generator. We all run on generator. Even in your home.
But
you
isn't
pay
this technology making life easier for
hold on. Then we were talking about building hospitals. Now, Agenda 111, they were building how many? 111.
Yeah.
By the time they were leaving office, they said they were building that in 1 year. 2 years, 3 years after they had left office, none was completed. And then I hear people go about the fact that we are cancelling contract because we are another government in power. If the deal is bad, it's bad. If it's fraught with corruption, it's fraught with corruption. If it has to be cancelled, it has to be cancelled. If it has to be reviewed, it has to be reviewed. If we have to do something better, we have to do it. And in this Zipline occasion, we are saying that the deal is bad from the word go. And under their own tenure, before the deal was even signed, questions have been raised about the cost of the project. Until today, it is still a burden on the public purse. Right. If it was easy, why didn't they pay? Why didn't the MPP government pay all this debt before leaving government? And you are talking about and the NDC wants to cancel and all that. And then you hear this emotional argument about, oh, it's in the remote areas. I know Ghana better than Ibrahim. He knows that better. I know Ghana better than you. There is no hamlet in this country that I haven't, not somebody drove me. I drove to myself. Every corner of this country because of campaigns. So he won't tell me what. We are a socialist government. We are better placed. We are better. Oh, come on.
Ibrahim, please.
Continue.
Please.
Before you came back to Ghana, please. You know, so please, I understand that there's the need. Can we do a tailor-made need? That's one. Why are we delivering everywhere? When there are places, you talk about Volta region, the routes in the Volta region itself, from Accra to Ho, from Accra to Aflao, it's not that bad. It's not one of the bad routes you talk about. You are talking about hamlets. You are mentioning Volta. You are mentioning Eastern region. You are mentioning which other region? So the arguments do not even support the fact on the ground.
Very well.
The fact is that Zipline contract has been fought with a lot of deals, a lot of corruption, a lot of mismanagement, and a lot of ineptitude from the Ghana Health Service. And otherwise, is the reason why they are unable to manage their stock. We have even started in this country where drugs were even in shortage. Shortage not only because of the warehouse, but because they didn't import into the country. So these are the systemic challenges to be dealt with, not to cover it up with drones. Now, the drones, do they manufacture drugs? The drones rely on drugs. He says that if you call and they, do you have drugs here? And they say, okay, we have it. What if they don't have it? What if they don't have it? So the system needs a holistic approach. It's not about just, having some drone out there, whether it flies or doesn't fly. It's a charge to the government purse. No.
Right.
Government can do better with that.
Elvis, 2 minutes on
Elvis doesn't have anything to say.
All that is neither here nor there. The issue is simple.
I wonder why.
The issue is simple. It's not Zipline that delivered
12.2 million.
It's not Zipline that import the medication.
We've delivered 12.2 million vaccines.
Put in place a world-class management system and says, if you provide the things and they are here, I am serving this facility. When they need all this system, all they need is a call. All that Zipline is doing is we have built a service, we are providing a service. If you ask me to deliver what I will deliver, a medicine I will deliver, that's what I do, is what I do. You understand it? If the government can do it, why is that the government was able to do it?
Exactly, you were incompetent. That's all we're saying.
Look at what he's saying.
Exactly.
Look at what he's saying.
Allow,
in 2012 to 2016, that NDC was in power. What was the situation of the health system?
Cash and carry.
Now I ask you, in 2009 to 2020, this was
now you are speaking for the MPP, so you speak.
No, I'm asking you.
Please allow.
You make spurious statement when people
are
dying somewhere.
What spurious statement?
It's an emotional statement. You had your turn. Please allow.
When people are dying, you don't play with people's lives. You have health system where, as I told you, core system don't even exist in a lot of these clinics you talk about. Where are they? If Ghana can do it, why didn't they do it all these years? Why, if it is easy to do, as you are sitting here and talking about, all these years, let's take the Fourth Republic, 1993 till now. If what you are saying, it is easy to do, and it's so simple. We have been in a democracy for the past 30-something years, from 93 to now. Why that as a country we've not been able to fix it? Why have you not been able to fix it as a country? We are in a country, we are talking about clear challenges that we know that, depending only on physical infrastructure, will be difficult for us to achieve. So deploy technology. So you are saying that Rwanda that is doing it, there's no value for money, but they are doing it. Nigeria that is doing, there's no value for money, and they are doing it. Cote d'Ivoire that is doing it, there's no money for it. It's only Ghana that is more sensible than all these countries to know that the thing doesn't add value for money. It's only Ghana that is more sensible than all the other countries that are implementing Zipline rules. That's why Ghana alone has found that it is not worth it. Please, let's understand it. In Africa and in West Africa, we know the challenges we have as countries. So everybody is trying to look for new ways to do it. So if Cote d'Ivoire is not saying that it doesn't offer value, Rwanda is not saying it doesn't offer value, Nigeria says it doesn't offer. It's only Ghana that is too sensible to realize that what Zipline is doing doesn't offer value. It doesn't make any sense to you.
Right.
Let's be realistic. Let's stop these kind of things of creating as if the thing is so. If it was so simple from 93 to now, I don't want any beyond 93. That we are in a democracy. Why is it that still there are so many hospitals clear that they don't even have common free to keep medication? Why is that there are so many hospitals and clinics around, they don't have a standby generator? Yeah. If it is so simple to do as he's trying to say, in the past 30-something years that we are in a democracy, how is that we have not been able to do it? These are questions you must know. And ask the thing is not that simple. So if there's an intervention that makes it better, you are talking about a motorbike riding from Ho to Aplau to go and deliver. You can go yourself. Say the roads are good. So if there's a blood in Trafalgar Regional Hospital, and there's a hospital in Aplau that need the blood, and there's no blood, now we have to give the one blood to motorbike to ride from Ho to Aplau to go and deliver. That's the argument he's making.
That's a low blow, but you didn't.
No, that's the argument you're making. That the roads are related good. No, that's why you are saying.
Hold on.
Didn't he say that the roads are related good?
He said relatively good roads.
So you don't need
and so the deliveries can be made.
So can be made, and that motorbikes are available. He even mentioned trotro.
Stop for the districts.
He even said that trotro do deliveries. Is that not what he said? He even mentioned trotro.
Please.
You want to give blood.
Okay, you finish and let me make my point.
You want to give blood to trotro to go and deliver. That is what he's saying here.
You make your point.
Please, these things even have to be kept under certain conditions. Blood, if you are transporting blood, the blood itself has to be kept under certain conditions. Because it's not under certain conditions, before you get to the place, it's not usable. So if we are looking at technology, and there's a way technology can come
Ghanaian
in
lives.
And help.
I should be excited.
Go look at the advanced countries now. Even food, in China now, food, you can sit here and order food and drone will come and deliver. So we should be looking at where the world is going. And stop thinking about building fiscal facilities and always sitting there. Somebody is a boss there who wants to know that this is my office and be clean. That is not where the world is going.
Right,
the world is moving far beyond that.
Right.
Even Zipline, even the U.S. government itself is working to deploy Zipline operations in the U.S., in America.
It's very true.
In America,
you should read before you come on the show.
In America, they're working to deploy.
No, you hear the nonsense.
He's saying it's not true. That's nonsense.
Come on.
We are all using the same media.
So you see, let's look at where the world is. We don't have to wait. The people leave us. That's what I'm saying. If Rwanda is using it, they are not saying it is not value for money. Cote d'Ivoire is not saying it's not value for money. Nigeria is not saying it's not value for money. What really is the problem? What really is the
comparison is this?
That Ghana that it's only Ghana that found out that it is not value for money.
Right.
When you all know, ask Akana to come and tell you how many hospitals. One that tell us how many hospitals in Ghana have cooling coaching facilities. Tell us. How many hospitals in Ghana have a standby generator?
Let me take a few messages and then we can move to other issues. Now, there's a proposal to put up trauma and emergency unit at Peki Hospital to complete it into a district hospital. That idea was shelved by the previous government to start a new hospital at Beve in the name of Agenda 111. No week passes without an accident on the Sukuma stretch of the Eastern Corridor. We need an emergency unit immediately to save the lives of Elvis's auntie. This is Kojo from Peki. Polished version. Okay, this one says, I was heartbroken when the majority leader announced the cancellation, it's a proposed cancellation, of the Zipline contract. How could a senior leader even consider ending an innovation that puts our nation on the global stage, one that, you mean Kamala Harris highlighted during her campaign? What informs this decision to discard such a groundbreaking program? The Zipline company should share with the majority leader the data showing the success of its 21st century innovation so he can give the matter a second thought. Aminu from Insawam sent that. I always say the NDC is a business killer, and anytime the party is in power, it sees nothing good from its predecessors. NHIA, school feeding, free SHS, Ghana card, free maternity, and many others were all the creation of the NPP. This is Ahmed from Nima. Mr. Wanda Madilo doesn't understand how the medical stores work. I can speak of the Western region. A CHIPS compound located in Adanse will travel all the way to Takrady for vaccines, and those vaccines will not arrive on the same day. Kwaku from La Paz says, Elvis Darko should give us a break. Did he think the Ministry of Health did no value for money audit before recommending the termination of the drones contract? No, I'm not sure it's the Ministry of Health that recommended the termination. It is the majority leader who has put it before Parliament. Hello, good morning, Anna. Please tell the NDC man in your studio to stop it. We'll stop listening to him. Does he know where some of us have been posted to? We take the cannons just to cross, the canoes, you mean, not cannons, just to cross over to our districts to work. And even the mottos he's talking about, we don't have. This is Ladi from where? Dedeso. Okay. Good morning, please. The Zipline we know was to deliver emergency services, but do you know that they are not operating as delivering emergency services? They're actually doing business because they always lobby with facilities to distribute their drugs and vaccines. How can you tell me in North Dine District, Vakpo, that you want to take my vaccines from Ho to Enum before you distribute to all my facilities with drones? Good morning. Dropping the Zipline project would be a huge step back. Innovative solutions like this push us toward a more efficient future. We should be building on what's already working, not throwing it away just when the value is becoming clear. See, I am from the northern part of the country called Nandom. People get bitten by snakes every time and the outcome is bad. I am disappointed in Wonder's submission. He should come again. I need to take a break. I need to take a break. I need to take a break. Just a minute. I need to take a break. I need to take a break. I need to take a break. I need to. You're welcome back. This is Breakfast Daily here on ChannelOne Television. We're having the news review segment. It's getting very, very interested. So I'm going to do 1 minute each. 1 minute, strictly. 1 minute each, and then we can move on to other matters. Ibrahim, 1 minute on Zipline. Close your submission and then let's move on.
The voice of the people is the voice of God. You listen to just a snapshot of what your viewers said. Everybody is castigating Wonder.
No way.
Not everybody.
Everybody is
not everybody.
No problem. No
Not
problem.
everybody.
I have a minute. Because it's about Ghanaian lives that we're looking at. Earlier, when Elvis was making submission, he said Nigeria is using it, Kenya is using it, Cote d'Ivoire, and America, to which Wonder said is not true. I said you should read before you come on the program that America is indeed using it. He said I'm talking nonsense. Used by healthcare systems. Where's the camera? Zipline operates in the United States, America, through partnerships with healthcare providers like Intermountain Healthcare, which use the service to deliver prescriptions to patients' yards in areas like the Salt Lake Valley. Because we read
It's a government contract.
No.
What means the government contract?
What
means the government?
Ours is.
Elvis made the point. You gave me a minute.
You see what he said? It's not even the
It's now you're not running.
It's not even medicine.
The service.
They are distributing prescriptions. What he say? You need
Prescription.
You get me?
Very well.
So they took 30 seconds of my 1 minute, but I will land on my point.
Please land. Please land.
Ghanaians, you deserve a government that prioritizes you, doesn't put a value on your health. A government that thinks of you first before its own election agenda or propaganda agenda. We introduced 2019. He says that, what if the vaccines have not been delivered? I can't remember what Elvis Wonder said. 12.2 million vaccines. We are 34 million people. In the past few years, 500,000 deliveries have been made over. 12.2 million vaccines, life-saving vaccines have been delivered efficiently, in minutes. And Wonder wants to tell us that it's a waste of money. Wonder doesn't care about your life.
Your 1 minute is up.
Wonder doesn't care about your life.
Is up. Thank you, Brian.
And that's DSTV's
Let's be clear. I stated clearly that the U.S. government has not procured the services of Zipline. And he said I should read. He went to read and embarrass himself.
How am I embarrassed?
The company that
I just told you.
company that uses the Zipline service in the US, it's not even for medical delivery. It's a MAT. It's called, the name of the company is Intermat. Again in Minnesota, that's where it was incorporated, somewhere in 1994 or something of the sort. So it's a private entity. The US government does not use Zipline. I put that on record. Finally, I never said that Trust will deliver drugs. I said that in every district, and if you don't know the structure of the Ghana Health Service, get it straight. In every district or municipality, we have a health directorate. In fact, we have a municipal director of health who is in charge of all the hospitals, the CHIPS compound and everything, management of health, just like we have for education. And I'm saying that those people should be empowered to have their own mini warehouses so that if the district does have a mini warehouse where drugs are kept and you know the volume of drugs, you know which ones go faster, which ones go less, you can stock your drugs. And so from the district to say a hamlet, to a corner somewhere, would have been easier. You have found this problem in 2018. You bought drones to solve it, saying that it was an emergency service. In other words, you should have made plans for the long-term service. Which is resolving the problem, creating the warehouses in the various places. You were busy chasing frivolous, contracts and deals, and never solved the problem from 2018 until 2024, when you were leaving government. 6 years after, you still keep delivering drones, delivering medical drones, and you are telling us that you have solved the problem. How is that a solution to the problem? It was a cosmetic approach. So Zipline was a cosmetic approach. It was shrouded in a lot of secrecy. The country rejected it upon its assumption and all that. And so we should not be discussing these issues as though we don't value
Elvis,
human
1
life.
minute.
I just found some small data. As of September this year, Zipline has done 1.6 million drone deliveries.
Well, we reading this from where?
Okay, I'll give you the source online.
Give it now.
Now, out of that, since they started, they delivered 20,000 units of blood. It means 20,000 lives, which should have been lost if there was no blood, were saved because Zipline had delivered 20,000 units of blood. How much amount of money can save these lives?
What analogy is this?
The point is, if we say Zipline is working, it's doing a good job, but we want Ghana Health Service to put together some local IT guys to develop a local solution to Ghana. I don't have anything against it because I want Ghana to also develop own system. I don't want us to depend on others for life. But what Zipline is doing today, everything shows that it is so efficient, useful, good for the people of Ghana. But if we feel that, as a country, how long can we let Zipline do this for us? Is it not possible? We have so many IT graduates in the system who have beautiful ideas. Can you even do some hackathon of ideas? People who have some of things that think they can do what Zipline is doing. Let them bring it on board. Let some work be done. And if locals can develop a system that can do same that Zipline is doing, well, I'll be all for it. But until we are able to do that, let's not go and terminate something that will lead to the death of people needlessly when those lives can be saved. As I said, Zipline was not brought in to come and do what they are claiming. Zipline is a service provider. If Ghana Health Service says, I want Zipline to deliver water, they will deliver. If we say deliver this essential medicine, they deliver. People are talking about distance. How many districts have district health drugstores in this country? You can't even get to a regional drugstore, and the medicine needed to save the person life is not there. But probably it is somewhere where within 30 minutes Zipline can deliver. So let's stop just making the thing look like we can only deliver healthcare in physical infrastructure. The world is moving on. The world is moving on. So we should be more focused on how
let's move to the issue of Afenyo marking being referred to the Privileges Committee by the Speaker of Parliament. This was upon a petition by the Majority Leader, Mahama Yariga again. The Deputy Minority Leader, Mama Pat, Patricia Appiagyei, is not too happy with this. She describes it as cynical and diabolical. She says it's actually meant to weaken the minority leadership in Parliament. Ibrahim, quick thoughts.
Thank you. And they won't succeed. Ghanaians can see the duplicity.
Oh, you agree there's a plot?
Honorable Afenyo Markins has been a vociferous leader in making sure that we hold this government to book. His statement on the budget is like a thorn in their side because you look at it dispassionately, see the areas where it is positive and where it's negative. They'll want to hear the positive. But when Afenyo Markins start talking about the deficiencies within their budget statement, they don't like it. Regarding, and I think we may discuss it, the vacancy or otherwise of the seats. I'm talking Pandai seats. See how he stood up for Ghana, making sure the rule of law was properly communicated. And the NDC don't want this kind of personality speaking. It's a way to somehow silence him, intimidate him. And if you know Afenyo Markins very well, this kind of political, guerrilla attack won't work. You rather encourage him to do more. When I say more, within the confines of Parliament. What exactly did he do? You're saying that he went to a delegation at Echoas Parliament where he was not on the list because there was another person, a replacement there. Was that replacement physically there? Do you know whether they declined and then he, in fact, maintained that position? Does that warrant somehow some kind of impunity against the Parliament of Ghana? That I was part of a delegation, I didn't go there to do anything other than represent Ghana. Is that somehow a breach? For me, when you are found in contempt of the Parliament of Ghana, it's where you bring or you say something that is inimical, that is against the workings of the House. We've had a case where members of Parliament from the government side have come and give out false figures regarding the presidential jets. When you're giving false information, if you didn't know, then maybe you should read before you go into Parliament. But if you knew, and you're trying to somehow not manipulate, but somehow convince Parliament of an untruth, that is contempt of Parliament. You're propagating a falsehood. I'm talking about the member of Parliament who was giving false figures about the cost of the presidential jet, then they retracted. That is something where the Privileges Committee needs to sit on and say, Massa, where did you get these figures from, which you stood on point? And I'm talking the NDC-MP. But this rather frivolous something, I say frivolous because where is the impunity? Where is the infringement? Where is the disrespect that warrants the Privileges Committee calling him to account for why he was on that particular delegation to the Echoas Parliament?
To be there? Had another person not been nominated to represent?
Yes, the information we have is that yes. But within that, does that warrant a Privileges Committee, a whole committee? Why not find out why is it that you maintained your position given that your time had expired and there's another person replaced? You have to look into it. And it's about, the integrity of Parliament should be based upon fact and not political expediency. Because when you as a speaker, we can see that you are fair to the issues that come up, and where somebody breaches the code of conduct, then you can say that, yes, I can see the speaker as being fair. And I'm just giving you some examples. Somebody comes and lies about the cost of the presidential jet. That one doesn't warrant an investigation to come and say, why did you come to this figure? Because Parliament is a office of record.
Yes.
And you can't say, oh, I didn't know. If you didn't know, read before you come. These are the kinds of things that the speaker should attune his mind to.
Right.
And say, you need to come to the Privileges Committee and answer why you did this. But somebody going to represent Ghana at the Echoas Parliament in Abuja, that rather is something that you will say, yeah, prima facie, you are in contempt, come and answer. But Afenyo Markin's honorable will not be silenced. He will not be silenced. He will continue to speak for Ghana constantly and put this government on its toes as we should.
Right. Thank you, Ibrahim. Wonder, the minority is accusing the majority of intimidation and is roping the speaker in, especially with this admission of the petition by the majority leader.
Yes, very frivolous commentaries. We have seen the tactics of the MPP in this parliament, and it has always been to rabble rouse, make noise, and albeit usually empty. Why? Because Afenyo Maki, at the time he became the speaker in the Echoas Parliament, he was deputy majority leader. And deputy majority leader at the time, he was part of the delegation. And so that has been the convention. The convention is that the deputies are the ones who go to that, occasion. Otherwise, in the last parliament, his boss, Oseche Mensah, would have been there himself.
Yeah.
So that has been the tradition. So anytime they are going to the Echoas Parliament, government of Ghana has representations from the majority, minority, and usually in the minority, it is the majority is the deputy who goes, in that stead. This time round, they had made the decision that these are the people to go. He was in Parliament. A vote was passed. They agreed, and the list of the people who are to represent Ghana in the Echoas Parliament was made. And then you show up in at the meeting in Abuja. Trying to bulldoze your way through it. I mean, how ridiculous. And the MPP is not worried about the image of Ghana out there and the things we do. You sat in Parliament, you saw the delegation, official delegation from Ghana. In any case, people are saying that, oh, he was already third speaker in the Echoas Parliament and so he was going. No, that position is not reserved for individuals. It's reserved for Ghana. So imagine Afenyo Maki didn't make it to this Parliament. Who else would have gone to that place?
But he made it.
No, imagine. I'm saying that is why the position is not for individuals.
But he's the speaker at the Echoas Parliament.
Can you listen to what I'm saying? Ghana is the one having the seat.
Right.
And at the time, it was Afenyo Maki we presented. And that presentation was because he was deputy majority leader. Get that straight. And because that position was for Ghana, the reason they give it to the state and not an individual is that likely you may not come to Parliament the next time. What happens?
Granted.
So Ghana still has the seat. So it is not a bona fide property of Afenyo Maki.
The position of third speaker at the Echoas Parliament, is it voted for? Is it an elected position?
In fact, I don't have
because
the
if
details
he's
on
elected,
that.
then he has every right
Ghana
to be there.
is elected. It's just like, it's a diplomatic thing. So it is Ghana that takes the seat.
Right.
And in our jurisdiction, by our convention, we always allow our deputy speaker, second deputy to the majority, to be the one in charge.
But in this case, the one nominated had ceded to Afenyo Maki.
That's not important.
Interested.
That's not important at this point. What is important is that the Parliament of Ghana, sovereign, took a decision that these are the people to go. If she wants to decline, she knows what to do. The rules of parliament, she rose to speaker after the delegation had left. So it's not as though Parliament could sit overnight and replace her. Even if she didn't go, it wouldn't have stopped the delegation to Ghana, to the Echoas Parliament, because other people were going anyway.
Yeah.
Number two, as third deputy speaker, you are only in the seat only in cases where you are needed. It's not as though you are the one to go and even run the show over there. You are only needed as and when, to do your job. So he shows up there without the backing of the sovereign people of Ghana, because he didn't have the backing of Parliament at the time. In any case, if he had a disagreement, he could have raised that on the floor of Parliament or have any other forum, which they usually do, to resolve some of these issues. So he put Ghana in disrepute. He actually embarrassed Parliament, because Parliament was the one who took the delegations there. If you are not interested, fair enough. Imagine on the day Afenyo Maki fell ill, God forbid that he was ill. He wouldn't have showed up anyway. So it's not as though the position is for an individual, and therefore if you don't go there, something untoward was going to happen. Even if that was the case, there's a procedure to follow. So we are not in a kangaroo parliament. We're not in a kangaroo republic that anybody gets up because of being boisterous, because you think that you are loud, or because you think you can speak the loudest and insult or say anything, then you decide to do what you do. So being hauled to the privileges committee is in order. I think that he knows very well that what he did was in bad faith. Nobody will do this and get away with it, and nobody's above the law. So the law will take its own course. I'm not asking that privileges committee should go and remove him from Parliament and all that. Nobody's asking that. But we need to put in the structures, the discipline, and that the MPP has the penchant for not respecting any order, especially when they are not in office. Even when they are in office, they bulldoze their way through. They want to have everything to themselves and all that. We cannot continue like that. For a party that claims to be thriving on rule of law and all that, they should know better. And that's what we're saying. Simple.
Elvis, there are those who argue that Afenyo was, if you like, gaining too much popularity at the Echoas Parliament. They even cite him bringing them to a futu for a congress or a conference and all that, for which reason the majority is deliberately trying to hack him out. What are your thoughts on this?
Before I come to that, I was giving you figures. You told me, where did I get this from?
Yes, the source for the Zipline.
Graphic online and republished by My Joy Online.
Very well, thank you.
And it says Zipline had delivered over 8 million different medical products. Okay. Out of the 8 million different medical products, vaccines alone are 70 million.
It's okay. It's okay.
Zipline operates in 14 out of 16 Ghanaian regions and covers 165 districts. Okay. The question is, are you saying that all these things, and interestingly, the government that is touting 24-hour economy is closing down the 24-hour business?
Oh,
the government is touting 24-hour economy.
Our time is almost up. Let's do it.
For me, I've always said there are certain things in Parliament. I don't even want to waste my time. They just do politicking. There are important things that they have to do for the people of Ghana. Okay? Instead of NDC sending a certificate of emergency to Parliament to make sure that the lithium 10% royalties is given, they'll call it. The other said no. they want to cut it down to 5%.
5%.
That is that's for me. So sometimes a lot of things that happen in Parliament. Sometimes I sit down.